Hi everyone, I'm Solomay Tibabu and I'm so excited to be joined by Dr. Acacia Parks, the Chief Scientist at Happify Health, where we're going to talk a little bit about digital therapeutics. So, Dr. Parks, tell us about yourself and what you do at Happify Health.
So as the chief scientist in the beginning of the product's time, I really was involved in helping understand how to translate science into a digital product. So at that time, there really wasn't much out there, and we had to kind of blaze that trail. So Happify at that time was a product that it was set out to be a consumer product. And so we were really just trying to figure out how can we take everything we know about how to improve mental health and put it somewhere that the consumer can find it. And I was sort of sobered by these numbers where, 1 in 5 people suffer from a mental illness, but then 70% of them don't ever receive any kind of care. So we were really trying to bridge that gap, and we thought going straight to consumers was the way to do it. And our thinking has evolved over the years, both in terms of who we are trying to help, right, in terms of focusing on consumers versus taking things into the more kind of employer and health plan arena, which was our kind of first pivot. And then later into digital therapeutics, where somebody is actually prescribing, a physician is prescribing a digital product for somebody to use to treat or manage a condition. So we've kind of played in all of those spaces, and my role through all of that is to make sure what we're doing is consistent with science, right? So everything that we're doing is directly pulling from the science and translating it into a digital format in a way that's faithful to that science. And then second, to do research, to test these things. So to actually apply them and design the types of studies that we can use to see that we're having the impact that we want to have.
Mm-hmm. Yeah, speaking of science, for as long as I've known you, way back when, you've been doing research in this space. So how do you approach researching, measuring, and validating digital therapeutics, and why is it important?
Yeah, it's a good question. And I think when we met, I was really kind of still stuck in this academic mindset of trying to just take what people were doing in person and slap it on a web page. And that anybody was doing at the time. But I was that thinking was starting to evolve as I realized, if the goal is to reach as many people as possible, that it doesn't help to make something that people don't feel attracted to using, right? Especially as things like Facebook started to appear on the internet, like things that people spend so much time on, intrinsically engaged with. It was clear that there are ways to design technology that can really draw people in and go really far beyond slapping information on a website. It was really terrible. I sort of chuckle thinking back about what I thought was going to help people. And it did. That's the funny thing, is it did, right? If you take literally what therapists do and you just put it in text and let people read it, that does work, right? I got started in this whole area because when I was an undergraduate, I read research that found if you gave people a self-help book, right? There's no human contact, nothing digital or engaging. Here's this book. And they read it, that they fared just as well as people who were receiving therapy from a therapist, right? So people are perfectly capable of teaching themselves how to do activities. And when we did that, like if we did the slapped on a web page approach, it did work, right? I mean, that was actually kind of amazing. It's just a question of, it worked for the people who used it, and you can make the number of people who use something so much greater if you do something really innovative and exciting. So, I think it's important to think about it less as just taking therapy and like translating it into a digital format, and really thinking, what are the things that only a digital intervention can do? So with digital therapeutics, for example, you start to see the advent of kind of artificial intelligence coaches, for example. This is something that we're very interested in. And given the shortage of mental health practitioners, right? So like even if people are in the 30% that are seeking treatment, there may not be enough mental health practitioners out there to help them. So the idea that we can train an AI using what therapists know to act like a therapist, that's something you can only do with technology. So instead of just trying to kind of kind of mimic what happens in real world practice, we can actually kind of do new and exciting things where we take the expertise of 8 therapists and use it to train an AI, and then suddenly you're getting eight therapists worth of knowledge in the same amount of time. So yeah, there's sort of the addressing the shortage bit, and also just the ability to channel so much information. So I guess the biggest thing, if I had to summarize in understanding how to tackle and research digital therapeutics, is to not be trying to think about them like in-person therapeutics. They're not. They're different. They're different, and even though we draw on some of the same methodology to study them, it would be a mistake to think of them as literally just an electronic version. It's not a Kindle version of a book.
Mm-hmm.
It's more than that. And then to sort of get to the last part of your question about just kind of how do we research these things? Unfortunately, the FDA gives us very clear guidelines for how we research these things, right? So as soon as you exit the wellness space and enter the world of digital therapeutics, where you're making claims about treatment or management of an actual condition, you're a digital therapeutic, which means you're a regulated medical device. So, on one hand, it's it's a sort of brave and bold new endeavor to be, studying these digital products, to think about treating mental illnesses, for example, though digital therapeutics can treat any kind of illness. I focus in the mental health space, but thinking about that, at least we have these sort of, international kind of guidelines about how we do good research. And the Digital Therapeutics Alliance is really valuable there as well, because it's kind of a group of digital therapeutics producers or manufacturers, of which Happify Health is one. And that's a sort of an alliance of businesses that kind of come together to establish standards for the field. But they're very much aligned with what FDA and other regulated bodies around the world are saying about kind of research standards.
Neat, interesting. Yeah, I can relate to the the piece you said earlier about the fact that just the information on the website alone, yeah, that certainly does help. I know that's how I got interested in this space, and how much psychoeducation helped me, even if it was like a super ugly MySpace at the time.
Yeah.
But yeah, to your point, if it's more engaging and user-friendly, of course, we would hope more people would be using it. And so speaking of what it is, can you tell our audience a little bit more about what consumers are using when they use Happify Health?
Yeah, so Happify Health is kind of a larger umbrella for several different types of products. So we have a product in the employer and health plan space that is still a digital therapeutic, but more about kind of the management of symptoms of depression and anxiety, of symptoms of heart issues or whatever else that are tied to mental health. So there's this whole suite around different kinds of illnesses there, but the goal in that side of our business is very much about kind of management. So we're not taking somebody with major depressive disorder and saying, if you use this, your major depressive disorder will be treated. It's more like, whatever else you might be doing for your major depressive disorder, if you use this, it may also be helpful in managing life with the symptoms that you're dealing with. And that there are a variety of products in that space, but very much kind of in the sort of management claims arena. And then on the other side, we have the prescription digital therapeutics. So these are products that are designed to treat an illness. The most notable prescription product that we have in the works is the result of a partnership with Sanofi. And they've partnered with us to create a prescription digital therapeutic that targets people who have MS, who are living with MS, but also have major depressive disorder. So it's a major depressive disorder treatment that is specifically designed to work with and around the various hurdles that are faced by people with MS and designed to be appropriate for that population. So on those two sides, right, they're targeting different things, but some of the mechanisms are similar. So across all products, you'll see certain engagement elements like gamification. So the co-founders of Happify originally founded a company called Oberon Media before they came to co-found Happify, and that was a highly successful casual game company where they learned a lot about how to engage people. And to the point of almost, over engagement, right? These casual games can be quite addictive. So they had worked together on that and wanted to leverage that to kind of help people do something good for themselves. So whatever product you're looking at, there's sort of certain core things: the gamification, the engagement, the way that it's designed to kind of pull people in. That's going to be there no matter what. But what differs is the specific therapeutic approach depending on what we're trying to do. So for example, at major depressive disorder, you're going to see like kind of heavily emphasizing cognitive behavioral therapy, right? So this is it's a treatment for depression. Makes a lot of sense to really lean heavily on that. If we're talking about something like insomnia, and we recently added a bunch of offerings on the platform that are targeting sleep, health, and exercise and these kinds of things. If we're targeting insomnia, we might also use CBT, but it's a very different CBT. And like Solomon, I know that you're familiar with what CBT is like, right? So if you're doing CBT for depression, it's very much focused on the thoughts you're having and ways to kind of think differently about what happens to you. CBT for insomnia is much more behavioral. It's focused on kind of the kinds of behaviors that you do and how those things might influence your ability to get a good night's sleep. And there might be some cognitive components, but it's a pretty different intervention despite being cognitive behavioral therapy. So what you'll see differs between the products are kind of these active therapeutic ingredients that directly target whatever that product is designed to target.
Mm-hmm. Wow, interesting. Why do you think now is the time for digital therapeutics?
Well, I mean, it's probably everybody has said some version of this that you spoke to in the last couple of days, but COVID-19 presents a set of opportunities to rethink how we do things, especially in contexts where how we're doing things is profoundly broken.
Yeah, right.
Mental one of those places, right? 70% of people not seeking treatment was bad to begin with. And now with COVID-19, and we read every day about issues people are facing with anxiety and depression, with isolation and quarantine, with anxiety about coronavirus and all of these things. So there's more demand, right, than there had been before. And our existing systems are taxed or irrelevant because in-person content's not possible. So it really is an important time to think about the potential role that digital interventions could have, because in addition to therapists in person being overly taxed, there's also the issue that they may be inaccessible. So I do think that this is a really important time for digital therapeutics to shine due to that kind of increased demand and the fact that it's accessible, and especially so one of the things I really like about Happify, right, which is this sort of 24/7 entirely digital tool. There's no coach, right? It's all about accessing the kind of the interventions and using them on your own time. and I think it's also particularly important because there is a profound impact of, telehealth and the ability to see a therapist remotely. I'm seeing a therapist remotely now, right? So it's that's obviously a really important piece of all of this. But I also think that there is a key role for a lot of the digital therapeutics. They offer tools that are available 24/7. So there are things that, if you're having a panic attack at 2 a.m. or if you're, feeling really depressed and your next therapist appointment is until next week, right? You have something else that you can work with during that time. So I do think that there's an important role, and digital therapeutics, kind of going beyond the telehealth to make certain tools accessible 24/7 is really, really important right now.
Mm-hmm. Yeah, absolutely. Speaking of coronavirus, there was some pretty big news about the FDA loosening its reins on the approval process for digital therapeutics in mental health. Do you know much about that? Could you tell our audience maybe what it takes typically versus what's changed?
Yeah, this is something that we've been thinking about a lot at Happify Health because the guidance very clearly states that for 8 specifically named mental illnesses, that digital therapeutics can be released during this time. It's an unspecified amount of time, right? until the state of emergency is lifted. And that FDA is not going to pursue regulation or oversight. Similar to some of the FDA guidances that were issued around testing, right? The idea is just like getting coronavirus tests out there is more important in their eyes at this time than taking the time to kind of go through the traditional process. So, I mean, that's a really big deal if you understand what the traditional process looks like, because typically, and of course there's almost no typically when it comes to digital therapeutics because the field is so new and we have so few data points. But typically, the digital therapeutics company does a large-scale clinical trial demonstrating that their product is safe and works. And then they wait 9 months for FDA to consider their application. So in addition to the time it takes to do the trial, which at minimum is typically 6 to 12 months, you do the trial, then you make your filing, and that also is 6 to 9 months. And even before that is the planning of the study and all of those things. So it's a very lengthy process to get something through the FDA in a more traditional manner in the world of digital therapeutics. So, I mean, it's really exciting, and obviously it's potentially scary because literally anybody could release any product that targets these disorders without repercussions. So it can be a little bit scary. That's again where I find the Digital Therapeutics Alliance to be sort of a very comfortable umbrella, because everybody at the DTA really agrees that there has to be rigorous research and we have certain standards for that. And everybody at the Digital Therapeutics Alliance is united under that umbrella. So if any of us were to release a product that we didn't have the research backing for, that would be considered something, against the views of the overall organization. So we're all unified under this idea that we need to do things that are safe and ethical. But like in the case of Acacia Interactive releasing their ADHD digital therapeutic, they've been in conversations with FDA for quite some time. They were very close. I don't know that, right? But we perceive them as being very close. So for them to release their product made a lot of sense. So there's really a lot of potential for products that have been through some testing, but we're not quite ready to go in the FDA pipeline or just sitting in the FDA pipeline to get to the public and help them now when that help is needed the most. So it's pretty exciting. And then from a research geek standpoint, I would say it's also just exciting because, the typical process, as I noted, was you do the FDA trial, you do the trial for the FDA, and then you do your filing. And then if FDA gives you permission, you release your product, and we're out of time. So, and then you release your product, and then you get to start collecting data in the real world. But this is a kind of a rare opportunity where you could both release a product and do a clinical trial on it at the same time and do real world evidence all at the same time. So there may be not another opportunity in history that a person can release a digital therapeutic and get to simultaneously understand its performance in the research environment and in the real world, and to be able to submit an FDA application containing both those types of information. It's pretty exciting.
Wow, yes, such an interesting time for so many reasons. Well, Dr. Parks, that was phenomenally insightful, super interesting, learned a ton myself about digital therapeutics today. So I'm really excited that you could share your expertise. And thanks for joining us, everyone in the audience as well.
Thank you.